Dr. Beck, besides of, you're a medical doctor and you specialize in nerves and muscles quite a bit. By doing so, you help people with, lower back pain, fibromyalgia, all kinds of stuff. So let me ask you this. Can you give me a list, kind of rattle it off a little bit, of which symptoms, if a person out there experiences, from numbness to the extremities, wherever, which symptoms a person would be well off and say, let's take one of those muscle nerve tests in order to find out that something very systematic is wrong or nothing is wrong, and eliminate, kind of like, go ahead and give us a good list of symptoms a person can experience where he would be wise to undertake such a test.
Mm-hmm. Well, for nerve damage, the one thing I tell people, if you have any type of numbness, tingling, or unexplained pain or weakness in your arms or legs, you need to go see a nerve doctor. This can be from a variety of different kind of conditions, and really the only way to sort that out is to do nerve testing. Now, the other thing that we've been talking about muscle disease, and if you have any weakness, particularly in your shoulders and hips, intense muscle pain, that just isn't like a simple strain or pull, and particularly muscle pain that's sort of an all-over pain, then I would say that's the number 2 reason to go see a nerve doctor and have possible nerve testing, because that could represent a variety of disease processes that need to be sorted out both through perhaps blood testing and also through needle examination of the muscles and nerve testing as well.
What are those varieties of things which need to be sorted out? I mean, what type of major problem could a person have there? Not necessarily, but could.
Well, with the muscles, there's a variety of muscle diseases that you can have. There's a condition called myotonic dystrophy. There's polymyalgia rheumatica, which affects older people, and this is probably one of the more common conditions I see, where people with just intense pain in their hips and shoulders, they get weak. And this is a disease process that usually responds quite nicely to prednisone or steroids. With regards to the nerves, carpal tunnel syndrome is probably the top of the list for things I see. I also see people with pinched nerves in their elbow or their funny bone. Frequently, polyneuropathies, this is nerve damage from diabetes. It's another very, very common thing that I see. So those are some of the most common things. There's some more unusual things that can come from nerve damage. So there's genetic neuropathies where, because of your inheritance, you will have nerve damage that's of a progressive degenerative nature that frequently we can find out with the nerve testing as well.
Mm-hmm. Okay. All right. So there's all that stuff. So if a person has weakness in the muscles or pain, numbness, he just simply should go and do such a test to make sure, because once a muscle or a nerve is too much damaged, it's very difficult to bring it back to life. Is that correct?
That's correct. For example, I saw a lady here in the office last week. She had arm weakness for almost a year, and when I saw her, she had terrible nerve damage. The arm was starting to waste away, and at that point, there's nothing we're going to be able to do for her. Her arm is already disabled, and so we really want to avoid getting to that stage. So if you can't move your muscles, they're weak, they're not working right, don't hesitate. Go get it checked out, because it could be serious, but it can be preventable and it can be fixable. So those are the main points I like to make to people.
Okay. Well, let me ask you something. It wasn't too long time ago, actually, that kind of both of my hands, the biceps here, those muscles, the ones which are supposed to be real strong in a man, my ones never really were very strong. And especially this one here, it actually hurt. And I found it out. My wife in a grocery store gave me a 3-pound cheese, like a big cheese. And she wanted to buy it, and I had it, and I kind of played with it, and I realized I can't lift it.
Oh, wow.
That's not good. I kind of I was standing there kind of looking around. I go, holy cow, what's going on? And it was majorly pain. Now, what I did is I actually used that particular 3-pound cheese and for the next few days kept lifting it, and it seemed to be having gone away. I'm not 100% sure, but is that something like that? I mean, Is that some type of onset of something? Am I supposed to go and get this checked maybe? And I do feel, I do feel it sometimes a little bit of like hurting and hurting in a weak way, like weak hurting.
Well, if the cheese treatment worked, I'd say you're probably not, you're going to survive. But, there's no harm in waiting a couple of days and checking things out and doing, like you said, maybe I need a little bit more exercise. Maybe I need to put a little ice on it. But the big point is if it's going on more than a few days, don't put it off. Go get it checked out, particularly if it's getting weak. And that's the one symptom that really worries me is when people get weak and can't use a muscle. Now, if it just hurts, that's one thing. But if it starts to get weak, you definitely got to get it checked out.
Mm-hmm. So I should, check it, because it could be that I just strained it. But it was in both arms. So it's unlikely that I strained both arms. You know what I mean? One was a lot worse than the other one, but it has been there in both arms. And unfortunately, after a few days of cheese exercise, I got a little better. Not good. It was still there. But then I gave it up because it got better. So I'll do something, because it's definitely more than a few days. Okay. Well, all right. Here you have it. So basically, any weakness in the muscle, get it checked out.
I would. Absolutely.
Okay. Because if it's early enough checked, there is hope to get it back to normal.
That's right. I see so many people that come in, and by the time I see them, the muscles actually disappeared. It's wasted away. And again, no matter what treatment you put into effect at that point, it's really not going to work. So sooner the better.
Got it. Thank you very much.
Thanks.